Hi everyone, and welcome to this TL1 Postdoctoral Clinical Research Training Award information session. Today we would like to provide you with a little of information about this program, how to apply, requirement, as well as have the opportunity to hear directly from our postdoctoral TL1 scholar, Dr. Akash Sash. So who we are? The TL1 program here at University of Maryland is being led by Dr. Khalil, that is the Associate Director, and myself, Luana Koloka. So what we do together, we provide our scholars with all the requirements to fulfill their needs and training direction to make sure that this 2-year experience can be successful and helpful for nurturing the future career. For those of you who are not familiar with the ICTR or CTSA, in general, the CTA is a grant that is related to nurturing the future generation of scientists in clinical research. So the scope of this award is to support the training of biomedical, behavioral, and clinical researchers through individual postdoctoral research training. So the TL1 is a component of NIH Clinical and Translational Science Award that we have together with Johns Hopkins University. At the University of Maryland, there are several schools, I would say all the schools: dentistry, law, medicine, nursing, pharmacy, social work, as well as the graduate school. And this is the first year that we include also University of Maryland College Park. We are very proud of this new collaboration and partner that will be working with us. The number of trainees that will be selected this year for the TSA award, we will have 2 applicants that will be selected from the 7 schools at University of Maryland and College Park will be funded internally for 1 postdoctoral trainee. So we will have 3 positions, 2 reserved for UMB and 1 for College Park. The duration of this training is 2 years. So what do we provide? The TL1 Postdoctoral Clinical Research Training Award provides financial support for the stipend. That means it's not the PI to cover for the salary, rather we cover for the salary. Tuitions, because there will be some intense training activities that require also to be funded. Training related expenses, from having a budget for research to covers for expenses to attend at least 1 conference this year, that is during the 2 years related to the CTSA. In terms of salary and some other budgetary level, we refer to the Ruth Kirschning National Research Service Award. This is a link where you can see all the details and the amount change on a yearly basis. There are some requirements. To be eligible to apply for this award, you must be US citizen or permanent resident. You must have received a PhD, MD, DDS, or compatible doctoral degree by the beginning of this appointment. This year, the appointment beginning will be July 1st, 2022. Eligible doctoral degrees also include, but are not limited to, DMD, DC, DO, DPM, OD, DPM, and so on. And currently we enroll scholars from one of the UMB schools, as we mentioned, but also we will have an internal funded postdoctoral trainee from College Park. If funded, no other federal funding are allowed. That means you can't combine different funds. This will be the only current live funds for these 2 years. No more than 1 year of prior aggregate NAR support are allowed. In terms of award requirements, we require to pursue research training full-time. So the goal is to nurture science, and we expect that you work on a research project at least 40 hours per week. It is also important to attend the didactical training seminars that will be offered at both UMB and Johns Hopkins University. We will ask you to have a specific research projects that eventually will be part of the application and to work with your primary mentor on your research project. Also, it is required to pursue training as a clinical or non-clinical postdoctoral fellow. And I would emphasize, this is not a program only for clinical research, even animal model research are a law, and we welcome research that cover relevant and significant clinical questions developed in animal models. It is important to complete a master's degree in the area of clinical research. The students must maintain a good academic standard with a minimum semester GPA of 3. Clinical fellows will have to satisfy requirements for specialty clinical boards. In terms of material for the application, we require a cover letter, a curriculum vitae, a personal statement, and the length is from 1 to 3 pages with a font of 12. On this personal statement, we would like to see the project title, the description of the project in terms of background, methodology, feasibility, expected results. We would like to learn about short and long-term research goals, research interest, as well as which specific master or certificate program the applicant will select and why completion of that master or certificate become relevant to nurture his or her career. If you have any literature being cited within this 3-page length application, the literature will not count. We also require transcript from all higher level institutions attended. And the application has a 2-part, apply for the award, but also the applicant concurrently will apply for the master or certificate graduate school application. And when you are being, apply and you need to select the master or the certificate, you can contact Dr. Khalil and myself if you have any questions about what is more appropriate, either completing a master or a certificate based on your prior training record. This year, the application is due February 11, and we expect to receive directly to the ICTR Navigator Maryland EDU 1 letter from a former mentor, 1 letter from the current mentor that become part of your application. I would like to stress that both applicant, so trainee, and mentor will be scored and evaluated for this kind of application. It is something that is a little bit a standard in many kind of federal NIH application for trainees. So what do we consider? When it comes to the mentor, we want to see the level of commitment with the trainee, how much effort, how much time, how many times they plan to meet, the mentor's prior experience, his or bioscale, the letter of reference, as well as the experience, research skills, record of publication, record of funds, verbal and written communication. All these things become part of the package for succeed during this kind of selection. Postdoctoral appointment must be not contingent with the TL1 award. Also, it is important to emphasize that not only the mentor is being evaluated together with the trainee, but often some mentor can be either too senior to have so many people to mentor, and there may be a lack of time to do a mentorship, or the faculty can be too junior. So in that case, it's important to pre-contact us and try to have an ideal package where if the faculty is too junior, eventually we can provide guidance how to secure a committee that can provide the right mentorship for the trainee, and that can be helpful in the process of selecting the trainees. In terms of what we do offer, so the TL1 trainee will be participating in research in progress and seminars that are mostly offered at Johns Hopkins University. We really encourage, collaboration, networking with our partners from Johns Hopkins University. We offer catalyst seminars, training in bioethics, ethics research, laboratory safety, good clinical practice, human subjects research, animal research, HIPAA, responsible conduct of research. We focus on informatics with different kind of online and non-online courses, professional development workshop that help to nurture skills from writing, presenting, management of conflict, leadership skills, and so on. And we are in a unique position to also nurture what we call patient-oriented research. In collaboration with our colleagues, our scholars have also the possibility to present at community engagement research opportunities where they learn the difference between scientific versus community-based presentations. And finally, TL1 scholars will attend the national conference for the CTSA. This year we will be meeting in Chicago, and the city varies year by year or sometime online during the pandemic. There are also some requirements related to mentoring and evaluating these 2 years of work together. I would like really to stress that this is something that we do together with the mentors. Indeed, there is a mentor-mentee agreement that is signed by us, by the mentor, by the scholars being selected. We also offer to meet with us bi-monthly, but also have ad hoc meeting whenever our scholars need to meet me and Dr. Khalil. And we monitor the progress. So we expect that people advance, they do well on the master or certificate, continue their research projects, and they publish. So we would like at least to see 2 first author publications for our postdoctoral trainees. Completion report at the end, we communicate with NIH about the results. And finally, we have what we call clinical research appraisal inventory that we do at the beginning to have baseline data, and at the end to see how our trainees are advancing after 2 years of intense clinical research and training. And with this, I would like to introduce our guest today, that is Dr. Akash Shash. He has been with us, and Dr. Khalil will ask some questions to Akash.
Thank you for being here with us, Akash, to share your experiences today.
Sure, no problem.
Can you give us a brief introduction of who you are, your year in training, your area of research, and when did you join us?
Yeah, so I am a resident in University of Maryland in the cardiothoracic surgery program. So I am now in my 2nd year of research, and we do our research years after 3 years of clinical training. So that puts me, 5 years out from med school. I primarily focus on cardiac surgical research, more so the use of like mechanical circulatory support devices in patients, and have been involved sort of with a breadth of things from animal experiments to clinical basically projects. And I joined the TL1 program last July is when I started, of 2020.
Thank you. And how do you believe the TL1 award boosted your career?
Yeah, I think the TL1 award has been really great for my research years. I think, obviously one of the advantages of this type of thing is you don't have to worry about your funding while you're in the lab for 2 years. And so you can really focus on your research projects. The additional benefits, I think, are that you have, one is you have additional funding for whatever project you're going to do that allows you to kind of, hit the ground running. as opposed to kind of waiting to see if your, PI has funds allocated to what you're looking to do. And the other big thing has really been, I think, the master's. And I see that's question number 3 here. But the master's has been a really, great thing, I think, in 2 aspects. I think one is that in general, clinical literature is getting more and more complex in terms of the statistics they do. And so it's really provided me with a way to better understand what people are doing and interpret, what people are writing about and decide how I'm going to implement that. And then it's just been allowed me to be really productive, especially, with retrospective or database projects. It's given me, I think, a greater ease of doing analysis, and I can just, sort of crank out the work that I'm going to do.
Great. Thank you very much for sharing. And you have been also very productive with publications despite conducting research, completing the master. Can you tell us a little bit about how you're combining writing as well?
Yeah, so unfortunately, the project that I proposed for TL1 is just recently been IRB approved. And that's in part because of COVID, and in part because the patients that I was looking to enroll were are patients that suffer from ARDS, and so that patient population was just a little, the IRB was a little bit more stringent with, what studies were going on with that group. So, to keep myself busy in the interim, I have been involved in a bunch of different things, in the lab. We have a pretty good animal effort, so I've been involved in, MCS implantations in sheep and other animal sort of things. But then aside from that, my mentor has been pretty productive in this realm clinically as well. And so I've been afforded the opportunity to write projects, go to him with ideas, and just basically fill the gaps in my time. So I've, probably over the last year and a half in the program, I think I've gotten about 20 or so publications out, and half of those being first author.
Exactly. Very, very productive. Thank you, Akash. That was very nice of you. Any questions from our attendant? If not, we can close these information sessions. Oh, Matthew, you can type your questions. So my speaker is not working. Matthew is asking, have you done any clinical time during the TL1 period?
So I've done some limited clinical time. I've taken a couple moonlighting shifts here and there, but since I am in a surgical residency, part of what's important to me in these 2 years is to kind of keep my surgical skills. And so I go on procurements, heart and lung procurements when they come up, and I've probably done about 20 of those over the last year and a half.
Thank you. Matthew, any follow-up question you can type and I will read it for you. Okay. Great. I think we can conclude this session a little earlier today. And I would like to thank all of you who attended, and feel free to contact me or Dr. Khalil or both of us anytime with any follow-up question. Thank you very much.